We're here today to talk about Russian electrical stimulation. So we have our patient, Dr. Becky Helms, is very nice to help us out today. So remember we talked about Russian electrical stimulation, and it's used a lot for muscle strengthening. It's very useful after having surgery when you have atrophy, or if you need to increase the strength of different muscles. So we're going to be using the Chattanooga Vectra for these setups. Initially, they're going to be the same on the Genesis, just of course with the button pushing. So we're going to be using, first of course, going into electrotherapy. So remember with NMES, we can use symmetrical biphasic, and we'll do a setup doing that as well. But we're going to start with the Russian. And so Russian, remember, is burst mode alternating current. Just like usual, we have to go into a customize for our settings. One of the first things we're going to look at is duty cycle. So the duty cycle, this is the Russian duty cycle. So this is how often the bursts are on and then off. Remember, for Russian, we want 10 milliseconds on and 10 milliseconds off, which is a 50% duty cycle. Again, we could decrease this a little bit, but that means that our amount of current that we're pushing is not going to be the same. So we want to keep it at 50%. The burst frequency, we do have an opportunity to go up or down. Remember, 50 beats per second or pulses per second or 50 hertz is where we want to be to get depolarization. Channel mode, single means that you're just going to have one set of electrodes in place. We can also do reciprocal, which you will see here then, puts channel 1 and channel 2 automatically, because if I do quadriceps and hamstrings, this means quads may come on first, followed by hamstrings. I can also do co-contract so that I can get both sets of muscles going at the same time. But we're going to use the single setup today. We do want a cycle time. If I leave it this way, once we turn the intensity up, it's going to be on all the time, which your patient will not be very happy about. So once we hit cycle time, you can see that it now brings me up choices for my ramp, my on time, and my off time. My ramp time can be up to 2 seconds. I don't want that long of a ramp time. We'll give her 1.5 seconds for it to increase to max. Remember, with Russian, the numbers are 10, 50, 10. So you want 10 seconds on, 50 seconds off for a total of 10 minutes so that you get at least 10 good contractions. So let's move our on time up to 10 seconds, and let's move our off time up to 50. Here's our time overall. We want 10 contractions, so we want that to go down to 10 minutes. So here's our current settings. We've got the 50% duty cycle. We've got our burst frequency at 50 pulses per second. Now remember, this is 50 pulses per second, but coming across at 2500 hertz. So it's a medium frequency overall. Our ramp time is going to be 1.5. Our on time is 10 seconds on, 50 seconds off for a total of 10 minutes. Now that we've got this done, we're ready to set up our patient. Our patient here. Remember, you want to go ahead and ask for contraindications. We should be explaining what we're doing and why we're doing it. So Becky, you've had a surgery on your knee, you've had your ACL replaced, and you've seen how weak that muscle is. You're having a hard time doing a quad set for me. So we would like to do some electrical stimulation to help with strengthening. So we're going to do something that's called Russian stimulation. And the reason we're doing this is, like I said, to help get that muscle so it's contracting again so that you can get strong, because we need that muscle to be strong to help control your knee during walking. walking and during all your other activities. You want to get back to your sports, playing soccer and all that other stuff as well. Okay? So we're going to be putting these electrodes on. What's going to happen, this is not the most comfortable of stimulations, so it can be a little uncomfortable for you, but I really want you to kind of breathe through it because it's good for you in the long run. The research and the evidence really shows that this can be very beneficial to you. All right? So we're going to turn it, once we get it set up, we're going to turn it on. Your muscle's actually going to contract on its own for us. Okay? Are you all right with this?
Yes. Do I also do I try to contract with it?
You can do that as well. Yep, I'll probably ask you to do some quad sets when it comes on.
Okay.
But I want to get it set up first and have you feel it a couple times so you can get used to it since this is the first time we're doing this.
Okay.
And then we'll ask you to contract that muscle as well because that will make it even more effective.
Okay.
All right? So we're looking at the skin here. We see that the skin is good where we're going to be putting our electrodes. We've already tested for sensation. We know that she doesn't have any sensory issues. Contraindications, we don't have any implants. Do you have any defibrillators or pacemakers? No. Could you or are you pregnant at this point in time? Okay. We know that again that she's got good sensation, she's got good circulation. So we're good with contraindications. No wounds. So it says our wound expert, so she knows there's no wounds. So what we want to do is remember you've got your motor point charts. So look through your motor point charts. We really want to get one of the electrodes close to where the vastus medialis obliquus is. There is a motor point here for the vastus intermedius as well. So we're going to put one electrode there, and we're going to put the other electrode up here on the other part of the quad to make sure that we get a nice contraction all the way through. So,
does the red and the black matter?
good question. The red and the black does not matter at this point in time.
Okay.
Okay? Because we are not using DC current and we're not having a charge build up, we don't have a cathode and an anode. So the red and the black doesn't matter. Okay? So they can go either way. All right, so we've got her set up. We've already set up our different parameters here. And this is probably the most difficult thing is we're going to have to turn the intensity up to where we get that good contraction. You don't want to go slowly with this because your patient will not be happy. And remember with the units, we do have to go a little bit faster. So we're going to have to turn that electricity up, that intensity up, until we see a very good contraction going here. And once we do, you want to hit that start button because it's going to hold for 10 seconds and then it's going to relax for 50 seconds. So that's the other thing as well I should have done in my instruction was say it's going to be on for 10 seconds and then it's going to relax for 50 seconds. So it won't be on all the time. Okay. All right. So when we start with this, we need to turn it up fairly quickly so that the patient it's not taking a long time to do so. So are you ready?
Yes.
All right, we're going to turn it up, and we're going to be looking for the contraction, and there goes the initial part of the quad, and we want to get a good contraction. Remember, it should be maximal. There it goes, and we're going to hit that start so that it relaxes. There goes the contraction, and it's going to hold for 10 seconds. Breathe, breathe.
I am.
Breathe. Don't let your patient hold their breath, and then it will relax. So this is going to cycle through. So we turn it up, we're looking for that initial contraction, which is right there. And then we want to make sure, remember it needs to go to maximum contraction, which is right there. And now we can hit start. You can see a very nice contraction going on here. It needs to be maximum tolerable, which sometimes is difficult for the patient. So you just ask them to breathe through it.